Thank you very much. Thank you very much, Chairman. Ladies and gentlemen, I'm delighted to be here in Pune as a guest of the Chalaram Diabetes Institute. And I'd like to take you all back to Newcastle upon Tyne, where I work, to a lonely hillside just south of Newcastle, where we have this impressive statue. It's called the Angel of the North. It's meant to represent the industrial past of Newcastle, but there it stands on a hillside, dramatic, 25 meters tall, with a 60-meter wingspan. So this angel looks down on the population and sees so many people with type 2 diabetes. What's going on? There are so many different ideas, some conflicting, so many theoretical concepts that are put over. But what could the angel deduce about diabetes? Well, maybe that people developing diabetes have conspicuously eaten more than they should have done and might have put on some weight, especially in adult life. So this matter of positive calorie balance seems to be an important part, an important point to start a logical, careful thought journey into type 2 diabetes. So if positive calorie balance causes this, perhaps we should start thinking about negative calorie balance. And let's go to that one. In 2006, thinking about these issues, I felt that really we needed to focus on this and see that if we start from positive calorie balance, we could perhaps explain the whole disease of type 2 diabetes. So let me just take you through this hypothesis, suggesting that the negative calorie balance would have the major effects on the two organs that are really driving type 2 diabetes. Where the glucose comes from, the liver. If the negative calorie balance was to reduce the level of fat in the liver, the research I was doing at that time was linking fat in the liver with insulin resistance in the liver. So take away the insulin resistance, suddenly we would expect to normalize the overnight plasma glucose. I'm sorry, there are some words missing here. But in the pancreas, how about, just imagine, if this simple disease was due not to many different causes, but to one cause, excess fat in the organs. Here we have excess fat in the liver, but how about the pancreas? Well, a long time ago, I remembered that Roger Unger, famous American diabetologist, showed if you give islets fat in the test tube, then they will stop responding to glucose. So why not say, if we decrease the pancreas fat, then the pancreas will be able to mount an immediate response to meals. So here we have the fasting state controlled by the liver. There we have the postprandial state, largely controlled by pancreas. Now, the beautiful thing about having a hypothesis is that you can find out how wrong you are, because it can be tested. So how can we test this to destruction? Well, we could take people with ordinary type 2 diabetes and reduce the calorie intake, bring about negative calorie balance. So we would actually reverse the processes that cause diabetes. To test this, we took a group of very ordinary type 2 diabetic people and gave them a low-calorie diet. This graph shows the fasting plasma glucose. On day 1 of the study, all the oral agents were stopped. Here we see the 8-week time course of the study. Thank you. And we can see that when we started the diet, this is what happened to fasting blood glucose. It normalized. So this was not just a sort of result you see written up in drug studies of a significant improvement. This was normal in 7 days. This has to be a liver effect. And you can see that it remained normal throughout the study with fasting plasma glucose. Well, because of the special techniques we had designed, we were able to examine each of the steps that we had proposed. And we can summarize this, the most important study, the COUNTERPOINT study, in this fashion. The rapid fall was associated with a dramatic fall in liver fat content. That caused a complete normalization of liver insulin sensitivity. Forget about muscle, that's a different story. The shots are caused by liver. And here we have normal sensitivity in 7 days. But very gradually, over the whole 8 weeks, the level of fat we could measure in the pancreas went down towards normal. And indeed, the first phase insulin response, which you would have learned from your textbooks, is gone in diabetes, and there's nothing you can do to bring it back. Well, that first phase insulin response came back. So we were certain that we were on the right track with this twin cycle hypothesis. Let me show you just one piece of information from that study. This is an MRI scan if you like, where we're cutting across the middle of the body. The person's legs are sticking out of the screen towards you. We're looking upwards. And so here we have the liver, but let's start off in this subcutaneous tissue around the body. Because this is no ordinary MR scan. In this scan, every pixel is color-coded for fat content over here. 100% fat is red. So of course, subcutaneous tissues over the stomach, all the way around, under the back, that's red. That's where the fat is. But just look inside the liver. Here we have this very unpleasant color, greenish blue, and you can see on the scale, it's about here. And indeed, exactly, this person's liver had 36% liver fat. This is severe fatty liver disease, and yet undiagnosed. You look at a patient with type 2 diabetes, you're looking at a person with undiagnosed fatty liver disease. The average liver fat in this particular study was 13.5%. We've since found the true average in the population is somewhat higher than that, and this was completely unknown. But what did that liver look like at the end of the 8 weeks? Let me show you that scan. It doesn't take a scientist to spot the difference between this liver and this liver, because this liver has 2% fat. So we've been bamboozled by drugs, we've been bamboozled by concepts. When it comes down to it, we're talking about a disease that's so simple. It's too much fat in liver and pancreas. But faced with these data, there was an obvious question that was raised as soon as this was published in 2011. This is an acute study. Surely everything's going to go back to diabetes when people stop this very low-calorie diet and go to a weight maintenance diet. Well, not so, because this was our second study, the COUNTERBALANCE study. This showed that liver fat was very high at the start, about 13%, and fell to 2% on average in this group. That was immediately after the diet, and that is 6 months later, provided weight was maintained. And in order to do that, we followed these people up and advised them every month their weight was exactly maintained, and liver fat remains 2%, their diabetes remains away. Let me show you their HbA1c. You can see that it fell from 7.1, 5.8, 5.9 at 6 months. So we knew that we were onto something really big here, and we can return to our angel on the hillside, and perhaps the thing about an angel or a sage is you can ask them questions, and perhaps they will ask a question in return. So in response to what should we do next to find out, well, could this be done in primary care? Because we had done this in a research centre. Clever doctors, intensive monitoring of our research volunteers. But in British general practice, people with type 2 diabetes are looked after not really by the general practitioner. There are too many of them for that. They're looked after by the practice nurse. So we decided to mount a study which would be comprised solely of education given by the practice nurse. And some practices had a dietitian, that person too. But this was, if you like, a barefoot doctor study. Can it be done simply? We trained these staff for 8 hours split up in sessions, in order to be able to do this and acquire the skills. So we're not talking about something that requires years of study. This can be transferred. Here we see the design of the diabetes remission clinical trial, direct, in routine general practice. And let me just emphasize that it was conducted on people with 6 years or less duration of type 2 diabetes. That's important because our early studies had demonstrated that we could achieve reversal in early diabetes, but beyond 10 years, it became less and less likely. So in direct, we said, right, 6 years only. The practices were randomized either to the intervention or to control, and control had the best management according to NICE guidelines. So they would have drugs to try and meet the target, advice about weight and all the rest. But the intervention group had the special input from the trained practice nurses to achieve 15 kilograms weight loss as the aim. Then the big challenge to maintain it. And you can see that this study lasted for 2 years as a randomized controlled study. 149 people in each group. So what do we find at the end of 1 year, at the end of 2 years? As this is the diabetes remission clinical trial, let's cut straight to the chase and tell you about remission. At 12 months, so after people had followed a low-calorie diet, lost the weight, then transited to the maintenance phase, at 12 months, we can see that 46% of people had no diabetes, off all medications. The control group data is also shown here. 4% of people managed to do the same. Of course, we can tell people not to lose weight, but as soon as they know they're in a study that is about weight loss in one group, there'll be a few people who do lose weight effectively, and that's exactly what happened. But the control group, with the NICE guidelines, by and large remained diabetic. How about at 2 years? Surely this wouldn't be retained. Let me just point out one detail of this slide. The dotted line here represents the 22%. My colleague and I designed this study together with Professor Mike Lean, who's an obesity expert in Glasgow. We had thought if we could take 22% of people out of type 2 diabetes, that would be a really worthwhile clinical result and a really worthwhile economical result, because type 2 diabetes is an expensive disease. But what we'd actually shown at 1 year was a huge excess of that. And at 2 years, we're still way in excess of our target. At 2 years, 36%, over a third of our group, had been managed by their own nurses and had no diabetes, off all tablets. So we were quite pleased with the results, which underscored that this is a simple disease. It has to be recognized as such. But in the follow-up period, something very interesting happened because a small number of people, just 13 people, actually put on a lot of weight again. They developed their diabetes again. And we were able to observe the diabetes developing for the first time in human history. So let me just take you through what we saw. And I'm showing here a graph of the fat level in the plasma, actually in the very low density lipoprotein fraction, which is what the liver makes and secretes. And that fell sharply in both groups. In the people who kept the weight off, it remained low. They had no diabetes. But in people who relapsed, just look at that. It's the fat being secreted by the liver that delivers that late payload to the pancreas, and diabetes develops. And that's emphasized further over here, where we see these responders who remain non-diabetic had actually lost a total of 1.5% of fat from the pancreas. That was from about 8.5% down to 7%. Whereas those people who had relapsed initially lost this, but then went back to baseline. And in going back to baseline, the pancreas became fatty, insulin secretion went down, and it all came back. But fat is not just fat. Now, Dr. Unnikrishnan in the previous talk referred to the de novo lipogenesis. Glucose is converted to fatty acid if it can't be stored safely, especially in muscle tissue. So people with insulin-resistant muscles, either genetically or because they tend not to exercise, are much more prone to type 2 diabetes. If the glucose can't go into glycogen, it has to go into fat. There is no other pathway open in the body for it. And we can see that our relapsers, who actually were developing diabetes, were pumping out the sole product of de novo lipogenesis, because glucose isn't turned into any old fat. It's turned into 100% saturated fat. The particular fatty acid that's made is palmitic acid. So here we see part of the mystery of what's going on with type 2 diabetes. And as the palmitic acid rises, and of course is supplied to the pancreas, we know from in vitro studies that palmitic acid is the most toxic kind of fat. So the first phase insulin response goes down, and you won't be surprised that these people got their diabetes back. How about those people who did not respond to the intervention? Because not everybody got rid of their diabetes. If almost half did at 12 months, the other half didn't. And then this next two slides, I'll show you data at the 2-year time point. You'll see the responders had lost a lot of fat from the liver and kept it off, whereas the non-responders had not really changed their excess liver fat content. And similarly, the relapsers had not changed much from baseline of their liver fat. How about the pancreas fat? I've already shown you for the relapsers, but here we have the non-responders. Once again, the responders had the fat out of the pancreas. They had a healthy pancreas again. The non-responders had failed to do that, had failed to change from baseline, and the relapsers were up there. But in this next slide, I'll show you the effect of this. Remember hearing that at the time of diagnosis of type 2, the beta cell functional capacity was already down to 50% of normal. That was shown in the UK PDS study. It's been repeated in many studies and in many different forms, such as histological studies, functional studies. How about in this study? Well, what I can show you here is the maximal insulin response. That is a surrogate for the beta cell capacity. And we can see that this response in the responders went back from 0.5, about half, because the dotted line shows normal, and that was about 1. The beta cell functional capacity goes back to normal. Now, in any talk, there's usually one slide that's worthwhile remembering, because out there in the coffee queue, people will say to you, what did he say? Did he show any interesting data? Tell them about this slide. This is important. It's been assumed that the beta cell always goes downhill in type 2 diabetes. That's untrue. It's a false concept. If we take away the driving factor of the fat, then we can restore the beta cell to normal in early type 2 diabetes. And all of this allows us to view our subject from a different perspective. What's happening in the beta cell for type 2 diabetes? Well, we now know from the work of Mimo Akili in New York that the beta cell can de-differentiate. It loses its specialist function to make insulin and just becomes a null cell that is hunkering down under stress. So we have a transition from a healthy beta cell under the metabolic stress of fat to a loss of specialized function. But what we've shown is that process is reversible, at least in the early years. If it's continued too long, then indeed the cells can become irreparably damaged, and then the type 2 diabetes would be not able to be reversed, at least as far as we know at the moment. But when you sit in your clinic looking at your patients, a simple way of looking at this is to imagine where your patient is on this spectrum. If they're just diagnosed, then it's highly likely that type 2 diabetes will be reversible. We found in DIRECT, if people lost 15 kilograms, about 15% of their body weight, then 9 out of 10 people would have no diabetes. This is not a heterogeneous disease. This is a disease of excess fat. But if they were further on in their path, then at an unpredictable time, they would gradually move to an irreversible state. So I can summarize this very simply. Here, I put up the trajectory to diabetes. Early on, the liver fat is there. The export of fat is raised, especially the VLDL triglyceride. That causes deposition in all the sensitive areas of the body. If a person's beta cells are susceptible to type 2 diabetes, and don't forget that that's only about 1/3 to 1/2 of the population. If a person is susceptible, then with this environmental trigger, they will develop the type 2 diabetes, illustrated by this histological picture of an islet. But the good news is that with substantial weight loss, which is maintained, liver fat falls, the whole process goes into reverse, pancreas fat falls, and the beta cells wake up. There are 2 ways I've shown going from diabetes to normal off all medicines. I've also shown what happened in those few people who couldn't manage to keep their weight down, and they go the other way, and the whole process returns. So we can now return to our lonely hillside. And there is a simple bottom line, because the best thing an angel can do is provide overall succinct solutions. And I hope you'll agree with me that type 2 diabetes is caused by excess fat in the liver and pancreas, and this is reversible. Thank you.